Since 1985, Bioject Incorporated has emerged as a leader in technology for safe, effective, needle-free injections. The Biojector 2000 is the industry's premier handheld needle-free injection system for intramuscular and subcutaneous injections and can be used in a wide range of healthcare environments. Bioject develops and manufactures the Biojector 2000 needle-free system at their headquarters in Tualatin, Oregon. Each Biojector is carefully hand-assembled, precision-tested, and inspected before being shipped to healthcare professionals. Over the last few decades, hundreds of medical abstracts have been published on needle-free injection technology. While Bioject has become a leader in needle-free injections, the technology itself is not new. As early as the 1940s, jet injections were used for mass immunizations. Unlike the old technology, the Biojector 2000 needle-free injection system provides the added benefits of a single-use syringe and regulated carbon dioxide cartridges. The Biojector needle-free syringe is the only part of the system that touches the patient's skin. And because it is discarded after one use, there is no chance of cross-contamination. Carbon dioxide, or CO2, serves as the power source for the Biojector and delivers a regulated amount of pressure for each injection. The old jet injection devices did not have either of these safety features. The Biojector 2000 meets or exceeds all state and federal OSHA guidelines for safety needle devices. As you know, a safer work environment means there's less risk for accidents. And using the Biojector 2000 means there's no chance of exposure to life-threatening diseases due to a contaminated needle stick injury. But to really understand how needle-free injections work and to begin educating your patients, you need to look below the surface of the skin. Bioject's needle-free injection technology improves the dispersion of medication throughout the tissue as compared to a needle-based injection. As the plunger on a traditional needle and syringe is depressed, a spherical pool of medication called a bolus forms at the tip of the needle. Needle-free injections rely instead on a high-pressure stream of the medication itself to penetrate the skin. As the fluid stream forces its way through the tissue, it follows the path of least resistance, resulting in a widely dispersed, spiderweb-like distribution of medication. And that's what this video is all about, describing the technology, explaining the differences and advantages to your patients, and teaching the steps in giving a needle-free injection with the Biojector 2000. Using the Biojector 2000 system includes the following: preparing the unit and medication for use, educating and preparing the patient for the injection, proper technique for giving an injection, and finally, how to care for the patient after the injection. The Biojector 2000 system consists of three main components: the Biojector device, the CO2 cartridge, and the sterile syringe with the blue syringe cap. In addition to the syringe and cap, the syringe packaging may also contain a vial adapter. The vial adapter is used only for drawing up medication. The CO2 cartridge provides the energy behind the system that propels the medication through the skin. When used properly, each new CO2 cartridge is designed to deliver a minimum of 8 injections within a 24-hour period. Insert a new CO2 cartridge in the cartridge chamber with the small end facing towards the back of the unit and close the cartridge cover. Turn the cartridge piercing knob rapidly clockwise all the way until you cannot turn it anymore. Tighten it quickly to prevent CO2 from escaping and being wasted. Again, you might hear the CO2 filling the injector. The indicator gauge, located at the rear of the Biojector, will be in the green zone. When the indicator needle moves to the center or the wide area of the pressure gauge, it's time to replace the CO2 cartridge with a new one. The device will not operate if the gas pressure in the cartridge becomes too low. To replace the CO2 cartridge, turn the cartridge piercing knob counterclockwise as far as it will go. You might hear residual CO2 being released. Then open the cartridge cover. To remove the old CO2 cartridge, tip the Biojector down and the cartridge will fall out. If it does not dislodge easily, simply nudge it towards the front of the device. The Biojector syringe is made of polycarbonate. It is latex-free and includes specially engineered components. The skin tension ring spreads the skin tight and stabilizes the syringe tip for a more comfortable injection. The plunger pushes the medication through the syringe and out of the tiny orifice into the skin. The proper steps for administering an injection with the Biojector aren't complicated or difficult, but it is important that you follow each step. Please locate the steps in giving an injection with the Biojector 2000 handout and follow along as we discuss each step. Selection of the appropriate Biojector syringe is determined by considering the intended route of administration, the size of the patient, and the injection site. Please refer to the Biojector 2000 Guide to Selection and Use of Biojector Syringes for a more detailed description on syringe selection. The syringe selection overview serves as a supplement to the Guide to Selection and Use of Biojector Syringes. This overview is not clinical data and is to be used only as an example of how to apply the data contained in the Guide to Selection and Use of Biojector Syringes, which is provided in each box of syringes. After selecting the appropriate syringe size, open the syringe package with the clear plastic side on a flat surface. Connect the syringe and the vial adapter by twisting the tip of the syringe and the small end of the vial adapter together. Make sure to grasp the vial adapter by the sides and do not touch either end of the vial adapter. Leave the blue syringe cap in the packaging for later use. Remove and discard the vial top. Disinfect the top of the vial with an alcohol wipe. Place the vial on a flat, hard surface. Hold onto the vial and insert the vial adapter into the rubber stopper of the vial and turn the vial upside down. Make sure the prong of the vial adapter remains inside the medication. Hold the vial adapter and the syringe in one hand and use your other hand to pull back the plunger to withdraw the medication. You'll see that the Biojector syringe size is printed below the dosage marks on the syringe to help ensure you're using the correct syringe size. When drawing in the medication, the solid red ring on the plunger should be just below the desired dosage mark. If you see air bubbles in the syringe, an additional hint to dislodge them is by using the rapid pull-push method. Do this with the syringe still connected to the vial. For medication that foams easily, allow a few seconds for the medication to settle. Disconnect the vial adapter in the syringe by holding on to the sides of the vial adapter. Twist and pull the syringe to separate it from the vial adapter, leaving the vial adapter in the vial. Then dispose of the vial and the vial adapter in an appropriate container. If your facility is not using a vial of medication with a standard 13 millimeter enclosure, or if you are using a multi-dose vial, you may opt to attach your own fill needle for drawing in medication. The last step before placing the blue syringe cap on the syringe is to make sure there is no air at the tip of the syringe. Excess air can cause an increase in bleeding or discomfort and can make the dosage inaccurate. To expel any remaining air, gently twist the plunger until you see a drop of liquid. Place the blue syringe cap on the syringe to prevent touch contamination. For medications that require reconstituting or mixing, remove and discard the covers from both vials. After properly disinfecting the tops of the vials with an alcohol wipe, insert the vial adapter into the diluent vial and withdraw the desired amount. Return to a flat surface and remove the vial adapter and syringe from the diluent vial and insert the vial adapter into the medication vial. Slowly push down on the plunger to inject the diluent into the medication vial. Follow the medication instructions for mixing the medication and diluent. When the medication is mixed, keep the syringe and the vial connected and withdraw the medication. Continue with the filling process as shown earlier in this video. Finally, insert the filled syringe into the Biojector. Align the syringe with the tabs on the Biojector. Never press the actuator without a syringe filled with liquid locked into the device. Push down and turn the syringe about a quarter turn clockwise to lock it into place. Check the syringe lock indicator window to make sure it is green. Now you're ready to give an injection. Because the Biojector 2000 is different from traditional syringes in many ways, it's helpful to explain the differences to your patients. That way, they understand the benefits of the technology and they know what to expect from needle-free delivery. For example, when you explain that the dispersion pattern is wider than with a needle and syringe, patients understand that there might be a slightly larger red area after the injection. Assure your patient that this redness is temporary. Be sure to tell your patients that the Biojector makes a sound like opening a can of soda as the injection is given, that all injections involve a sensation, and some medications may cause slight burning or stinging. Choosing the correct injection site is critical to achieving the expected results with maximum comfort. For better medication dispersion and patient comfort, it's important to administer the injection into the body of the muscle. For intramuscular injections, the usual sites are the deltoid, dorsogluteal, and vastus lateralis. Refer to your provider or institutional policy on injection site selection. For subcutaneous injections, it may be helpful to move the tissue mass forward. This will also make the injection more comfortable. The usual subcutaneous injection sites are the dorsal and lateral areas of the arm, the lower parts of the abdomen, and the anterior fleshy parts of the thigh. Once you've chosen the proper site, prepare the skin for the injection by disinfecting in an outward circular motion with an alcohol wipe. Allow the alcohol to dry completely. If the site isn't dry, the alcohol may sting the patient during the injection, the device might slip, or the site might not be completely disinfected. Remove the blue syringe cap. Have a gauze pad or cotton ball ready to apply immediately after the injection. Stabilize the patient's arm or leg firmly with your free hand. Be sure to immobilize the site to prevent sudden movement during the injection. Push the Biojector syringe very firmly against the site at a 90-degree angle perpendicular to the skin. Medication that enters the skin diagonally and not straight through the skin may cause more tissue trauma and splashback. Apply enough pressure to achieve a dimple effect. This will spread the skin taut, stabilize the site, and allow for a more comfortable injection. To promote muscle relaxation, ask the patient to take a deep breath. Then while they are exhaling slowly, administer the injection by firmly pulling the actuator back and releasing it in a quick, smooth motion to prevent wasting CO2. Do not move the Biojector while delivering the injection. You will hear the CO2 exiting the back of the Biojector after the injection. Continue pressing firmly against the skin, maintaining the dimple. This helps minimize discomfort and bruising. Don't move the Biojector until you count 1001, 1002, 1003. Immediately after the injection, apply firm pressure with 3 fingers at the injection site for 1 full minute to minimize bleeding and bruising. Because of the wide dispersion pattern, it is important to use 3 fingers to completely cover the injection site. Hold pressure longer for individuals with blood clotting deficiencies. Do not rub or massage the injection site. This can cause bruising. After 1 minute, remove the pad. You will see a temporary circle pattern on the skin from the firm pressure of the syringe. You may also see a drop or two of blood, which is normal. Apply a bandage over the site if needed. Finally, remove the used syringe by pressing down and turning it counterclockwise 1/4 turn and dispose of it in an appropriate container. Remind the patient that the medication may cause mild soreness, redness, and swelling at the injection site. As mentioned earlier in this video, proper injection technique is essential for administering successful injections. When instructing a patient for self-administration of their injection, the same preparation of the unit, preparation of the medication for use, and proper injection technique apply. Be sure to discuss with the patient the best injection sites to administer their medication and review proper injection site rotation. Let's review the entire process. Select the appropriate syringe size. Fill the syringe, expelling the air bubbles from the syringe tip. Place the blue syringe cap on the syringe. Insert the syringe into the biojector. Choose the correct injection site, then cleanse the site and allow it to dry. Stabilize the site. Hold the biojector at a 90-degree angle using firm pressure to dimple the skin. Encourage muscle relaxation. Press and release the actuator, holding the biojector firmly for 3 seconds. Apply pressure with 3 fingers for 1 minute. To assure the injection is as comfortable as possible, the following hints may be helpful. To maintain a 90-degree angle and to reach the proper injection site, it may be necessary to make adjustments in positioning. For instance, rotating the child's thigh slightly inward may make it easier to reach the vastus lateralis. Refer to your institution's policy if more than one vaccine must be administered in the same limb. When giving an injection in the deltoid of a pediatric patient or a small deltoid, it's helpful to move the muscle forward to increase the tissue mass. For self-administration, have the patient sit while injecting and extend the leg for injections into the thigh. Clean the outside of the biojector with a cloth or paper towel dampened with a standard cleaner or alcohol. Do not try to clean the inside of the biojector, and do not immerse it in water or any other liquid. Remember, proper injection